Okay, I am Dr. Neeraj Awasthy. I am Director, Department of Pediatric and Congenital Heart Disease at Fortis Escorts Heart Institute, Delhi. Now, congenital heart diseases means those heart diseases which are present right from birth. And the incidence continues to be almost 3 per thousand. But the problem is, the diagnosis has been a recent advancement. And this is for this reason, the number of patients which we are seeing now are much more than what the incidence is. We call it iceberg phenomenon. That means the number of patients which we see are like an iceberg. What we see are much less than the number of patients which exist in the community. Well, the treatments have advanced, the results have advanced, the outcomes have become almost like a normal heart. Whether you need to do a good counseling, the importance is you do appropriate diagnosis. The right way to diagnose such congenital heart diseases is your pediatrician picks up with certain signs, like if the child is not growing well, the child is having reported pneumonias, the child is getting blue, he gets very tired as compared to other children around. In these cases, he will send for an evaluation, which is essentially ultrasound of the heart. Now, the ultrasound of the heart is a non-invasive test. It's not going to cause any problems. In fact, it is done in pregnancies because it has got very, very good outcomes with no side effects. You can repeat ultrasounds or echocardiography n number of times without any side effects. So, the child goes through an echocardiography. Most of the time, the echocardiography is going to give you the diagnosis. And diagnosis does not mean that every diagnosis needs a treatment or a surgery or an intervention. Diagnosis will guide you as to what is the right method, what is the right way. Most of the time, you just need counseling and many of them will heal on its own. Nowadays, many of these procedures can be done even without surgery with intervention. Like leakage in the valve, you can deploy a valve there without surgery with excellent long-term results. You can close the holes in the heart with devices or open up the closed areas with ballooning or stents with absolutely normal long-term results. Few cases may require surgery. Over a period of time, the scientific advancements have ensured the surgical results are also very, very good. Be it surgery, be it intervention, pediatric cardiac results are now like normal outcomes. The child goes to normal school, behaves and contributes to the society like a normal individual. And of course, once treated, it is treated for life. This juncture, it is very important that it is not just the disease, the treatment which has advanced. Lot of support in the form of various organizations and NGOs have come forward because financial limitation is one of the important limitations which we think when we deal of heart diseases. Because of lot of organizational support, almost every center who is doing congenital heart surgeries or interventions has got enough NGO support to help you out. The only importance is you seek the appropriate diagnosis at the appropriate time and get it treated. So, echocardiography is a very good non-invasive test. The availability of echocardiography and the skill set to do echocardiography is definitely not that widespread. So, best person to pick up any congenital heart disease is your pediatrician, one who delivers the baby. He's going to look at the heart murmurs, the heart sounds, he's going to look at the oxygen levels, look at the pulses, and then decide whether you need an echocardiography or not. If available and if needed, echocardiography is the standard of care for diagnosis, and it's almost going to pick up almost all the congenital heart diseases and guide you appropriately.